Hello, this is Dr. Staker coming to you again with a community update. We are on the other side, at least at this point, of our COVID epidemic. The last time that we recorded a message for you, we were looking at this from the front side, and now we've lived it all together for a few months, and we wanted to take a few minutes to express our gratitude to you. We have prepared for something unprecedented. We prepared for this epidemic the best that we thought possible, and we took some drastic measures. We needed to restrict the visitation in our hospitals. We restricted many things in protecting our staff and our patients and our community, and we're grateful to you. You saw us set up a triage tent, and if you've been to the facility, you've seen that we're screening at the doors. We're trying to do many things to protect you and those that we care for, and we're grateful for your patience. This has been an inconvenient time. Inconvenient for you, inconvenient for us. None of us want to do this again, but we're really grateful for what you've done. Our community has been remarkably protected. We've had very few cases, and we feel like that is attributable to many factors. One, to many of you who are willing to shut your businesses and shutter your doors and social distance from people that you love. We're grateful for what you've done, and we feel like it made a huge impact. We feel like the efforts that we made as a hospital made a big difference in what people were able to do and protecting them from something that could have been really scary. So thank you for your time, for your efforts, and for your understanding. Okay, so an update on where we are currently. We've had very few cases in the basin. We continue to have very low numbers. We have had an uptick recently and a few more cases than we had had previously. We're watching that very carefully. We have not, as of yet, had any more hospitalizations. We had one early in the epidemic, and we have not had anyone else admitted for that diagnosis here in the hospital, and we're grateful for that. We're grateful that no one has suffered more severely. We still have certain areas of our facility that are being still aggressively protected. The villa remains on a red scenario. We won't allow any visitors or anyone in or out of the facility. Those are our highest risk patients, and we're doing everything we can to protect them. So that's still at a red, but everyone else, we're allowing you to come. We're hoping you'll come. We are open for business. We want you to come and participate. We feel like of all the places in the community, besides your own home, this is probably the safest place you can find. We are careful. We clean things continually. We are social distancing. We're wearing masks. We're asking you to do the same, and you can feel comfortable coming here. This is a safe place. We don't have disease that we will spread to you, and we'll do the very best to protect you when you come. As we enter this next phase of this epidemic, we just wish to express to you again our concern over the disease. It's not gone, it's still here. Very low incidence where we are, but we're still taking extra precautions, and we would encourage you to do the same. Wash your hands, don't touch your face. Stay social distance whenever it's possible. Don't gather in large groups. Avoid situations where you know you might increase the risk to spread this disease to someone else. Luckily, many of us have not had any symptoms, and even as we've studied the disease more, people can have the disease without symptoms. It's very important that we take extra precautions not to spread it to people who could be vulnerable. So join with us, continue to protect our community and protect yourselves, and we will get through this epidemic together. Thank you for your time and for your patience and for your cooperation.